Advancements in nursing per year since 1881. This is a detailed list of major nursing school educational achievements over time. Although the list below includes only a small selection of worldwide contributions, it was created to inspire nursing students as well as educators and future nurses alike. Nursing in the 1880s. Hamilton would then go on to become the first woman professor of medicine at Harvard and the founder of industrial medicine in America. Nursing in the 1890s. 1894, the first nursing conference on record is held in Washington, D.C. It was organized by Dr. Florence Dietrich, who invited 16 of nurses to attend and discuss the various accomplishments made so far in their profession. The meeting helped establish the National Association for Nurses. 1900, Dr. Emily Howe opens a nursing school that was intended to train nurses for surgical procedures. It is located in New York City at St. Luke's Hospital and Dispensary, later known as the Roosevelt Hospital School of Nursing. Nursing in the 1900s. Also that same year, Dr. Julia Potter of Michigan begins offering free classes for training hospital ward assistants or nurses' aides, which were designed to help speed up patient recovery times by relieving physicians from basic medical tasks. Over 600 women were reportedly trained between 1903-04. Also that same year, records show that Miss Martha Leary had become the first ever African American to become an RN. She graduated from the Lincoln Hospital Training School for Nurses in Kentucky. Nursing in the 1920s. Also that same year, the New York Training School for Nurses, also known as Nightingale Settles, was established and is known for having one of the first programs to offer on-site internships. Its founder was Dr. Anna Bushnell. She helped establish a similar school back in 1920. How nursing evolved in the 1930s. 1932. The American Journal of Nursing was established by the National Organization of Nurses. It was officially published in April of that same year. It covered topics related to serving as a nurse in a hospital within New York. And on the 27th of June, Florence Nightingale's sarcophagus was removed from Westminster Abbey to be relocated to her grave site outside the church. Her remains had been moved multiple times prior. 1940, in Canada, the Council on Public Relations with Dependent Services was established to help improve healthcare procedures and represent nurses. It existed until 1950, when it was succeeded by SINPAD. Both organizations worked towards forming agreements with hospitals and other healthcare facilities. Nursing in the 1940s. And in England, the diploma in nursing was replaced by a 2-year state registered nurse course. It covered topics such as dressings and wound care. Catherine Tracy Macy collated her works within nursing classics, which included anesthesia, clinical management of perioperative pain, and principles of anesthesia nursing. Nursing in the 1950s. Nursing in the 1960s. Working during this same period, Mary Breckinridge completed her nursing education and set up the nursing department at the University of Kentucky. Breckinridge later went on to found a school for midwives. During her tenure, she also found time to help found several associations and journals related to nursing. 1965, Jo Tomlin, a nurse practitioner at Lahey Clinic in Burlington, Massachusetts, developed the first program for family practice nurses. The program was designed to bridge the gap between nursing and medical practices. Nursing in the 1970s. Nursing in the 1980s. Also in 82, the Journal of Advanced Nursing publishes an analysis written by Dr. Joan Clark on her experiences with improving student nursing care and education at Elizabeth Isherwood Regional Health Centre in Ontario. This article is significant because it uses historical data to present the problem and suggests solutions which may have helped boost morale for nurses of the future. Nursing in the 90s. 2007, nursing students from the University of Michigan School of Nursing published their study in the Journal of Nursing Education, which examines the current issues that influence patient safety among nurses. This study is significant because it examined how the shortage of registered nurses and inadequate healthcare communication often leads to medical errors which can pose a risk to patients not only by slowing recovery but also through causing discomfort and pain. Dr. Laura A. Tarantino Bradley and Dr. Linda M. Chofu published study in Journal of Peri-Anesthesia Nursing that examines the experiences of nurse practitioners in a hospital setting. University at Buffalo School of Nursing, Department of Applied Behavioral Science published a study in the Journal of Perinatal Education. 2018, Nursing College of Wisconsin published a study in Journal of Nursing Administration that analyzes how nurse educators can improve the transition from educational to clinical settings.